Alright, here's our cyberanatomy preview for the Pharynx and Disarticulation lab. This is kind of a short lab once the big work's done, but it is some big work to expose this region, so I'm going to try and lay that out real clearly with the preview here. So the area we're going to focus on is what's basically between the airway and the viscera and the vertebrae of the neck. And what we're going to be doing is actually detaching the skull from the vertebral column at that atlanto-occipital joint. So there's a fair amount of prep work to be done in order to expose this. The first thing you might do is just get your hands into this space behind the trachea and the esophagus and get your fingers to touch behind there and really loosen that space. That's going to expand a space that's called the retropharynx. That'll make it much easier to get the head to push forward when we're finished. So probably the next prep step you should do is to go into the cranial vault, look down into the foramen magnum. You'll see the spinal cord down in there. But what you won't see is what's behind these ligaments on the foramen magnum, the anterior wall. What's actually behind there is the dens of C2, which is located right there. There's the axis, and there's its dens. And all of these ligaments sort of cover up that dens and hide, and well, what they're really there for to do is to hold the dens against C1 and then ultimately against the skull. So that's if we can disarticulate the atlanto-occipital joints back here, but if that joint hasn't been cut and the ligaments haven't been severed, it's going to be hard to disarticulate the head. So you'll basically just take a scalpel and go down into this space. You won't see exactly the landmarks that you're going for, but you'll easily be able to feel the dens in this space. Take your blade and just make a big upside down U like around the dens. And when you're done with that, you should be able to rotate the head about 45 degrees to either direction. So you'll know right away when you get that done effectively. The next area we're going to have to do prep work on is back in this area, because we're going to be approaching from the back. So we're going to need to basically take a blade and cut through all of the posterior muscles of the neck, and this will probably include some, if not all, of the sternocleidomastoid. We'll have to cut away from the mastoid process and just to freely expose this area. So if you have this open enough, you'll be able to actually see the posterior arch of C1, and you'll be able to see the bottom of the occipital bone. Now, some of you may have a wedge cut out from when we removed the brains. That's okay. It won't affect this procedure all that much. But our goal is to really clearly identify the space between C1 or C1 and the occipital bone. We're going to be using chisels to pry open this joint and expose that space. And about the only thing you can do wrong on this dissection, which I did wrong the first time I did it, was put the chisel between C1 and C2. It really changes the way the dissection looks when you're finished, and I want to avoid that happening. So we're going to try and help you do this disarticulation as much as possible. So unless you're really confident, feel free to just let us take the reins on this one and make sure it gets done right the first time. This is just a little bit more exposed so you can see the full extent of C1. It probably won't be this plain to see, but we want to be in this space so we can at least visualize the joint. Once that's done, we're going to push the head forward so it can, let me see, I think this is probably going to show us better here. Yeah, I got rid of a little bit of junk. We're going to be pushing the head forward off of the vertebral column. All of the viscera will stay intact and connected. All the nerves will stay intact and connected. All of your previous dissections will be fine. But we're going to be just sort of separating the head and the visceral elements of the neck from the vertebral aspect of the neck. And what you should be able to do is take the head and it should be able to rest on the chest. So once you get that exposed, the first thing you should probably do is take a look at the vertebral elements that are sort of still intact as one whole entity. This is going to allow you to see some of the prevertebral muscles we discussed in Unit 2. So this is a good review for those, since they do show up on the final. This is a good time to review them. The muscles in this group that you should be able to identify pretty easily are these really short ones called rectus capitis anterior and rectus capitis lateralis that are coming from the transverse process of C1 up to the skull on both sides. And then there's long muscles that run along the anterior surface of the vertebrae up to the skull. That's longus capitis. And these may or may not be still attached to the skull. So they may be laying here on the vertebrae, or they may have ripped off of the vertebrae and maybe be hanging from the skull. So have a look and see what yours ended up doing. The other muscle that you'll see in this area is longus colli, and this is multiple muscle bands that are actually laying directly on the anterior surface of the neck. It'll be very easy to see this muscle. Once you're done with that, then we'll turn to the other side, and we'll look at the muscles of the pharynx, some of the neurovascular structures in this space. So I'm just going to get rid of all that transparent stuff, and we're just going to focus in on these structures. So the first thing you might want to do if you're sort of a slow dissector and you're a little bit non-adventurous with the blade is to take a look at these muscles of the pharynx and see if you can't peel off some fascia to expose some of these muscle fibers. These are actually three semicircular muscles called constrictor muscles. There's a superior, a middle, and an inferior. They're usually not this easy to distinguish in the cadaver, but the key to identifying them, at least at this stage, is by seeing the different fiber orientations. That helps to give some of that away. There is a much better way to tell them apart, and we'll get to that at the end. So this is sort of the crux of today's work, is once you get into this space, you're going to be working on some of the blood vessels and nerves that we've seen before, but this is the part of the story that we've been missing all along. So first of all, we've got our internal carotid artery, which would have a common that comes down here, an internal jugular vein. These two structures that you've seen together before, down when we did our neck dissection, down in here. It's just a little bit farther up the road. But we'll be able to see them, and carotid's always medial to the jugular. That's pretty typical. As far as nerves go, the first two nerves you'll see straight away are the vagus nerve, which is typically posterior to the carotid artery, and the superior cervical ganglion, and the sympathetic trunk that is hanging down from it. So this is a very large sympathetic ganglion, just like the ones we found in the thoracic cavity, but much, much bigger. And these two structures this is typically found medial to the carotid. So observe and really recognize these relationships, because they're really standard in this area. It makes it very easy to identify these nerves. The next nerve you should find is actually going to be between the carotid and the jugular. That's the hypoglossal nerve. And you may remember this nerve from before when we did it in the anterior triangle of the neck. Oops, I want to go this way. So the hypoglossal, before when we found it in the carotid triangle, and then peaking just for a quick minute in the carotid triangle, and then going up into the submandibular triangle beneath the digastric, near the mylohyoid, some of those structures from the anterior triangle of the neck. So you see from this relationship, we're not really that far away from where we were before in the neck. This is just the beginning of the story for where the hypoglossal, right after it got out of the skull. That one is always lateral to the carotid, medial to the jugular, in between. The next nerve you'll probably find is going to be the most lateral of them, the accessory nerve. You'll find this one lateral to the jugular vein. It's the only one that's that far lateral. You might find it associated with the muscle of the sternocleidomastoid. It might look like it's piercing through it or running along it. But definitely you want to be looking out lateral to the jugular vein for that one. So you see they all kind of line up in a row, these nerves and blood vessels. Once you get these done, you'll want to turn to cranial nerve 9, and this one is easiest to find more medial. I can just see it right up in there, but in order to see it better, we probably want to push the blood vessels and nerves out of the way a bit. This is going to let us see the glossopharyngeal nerve, cranial nerve 9, sort of running at an angle and going into the pharynx, between those the superior and middle constrictors. And it is always associated with this muscle called stylopharyngeus. This is a muscle of the pharynx. This is the one muscle that's innervated by cranial nerve 9, so it makes sense they're together. But this is a little bit more anterior than the rest of the nerves that we just did, so it will be helpful to push some of the neurovasculature aside in order to see that more effectively. Okay, so that's 9. So we've got 9, 10, 11, and 12. We got the sympathetic chain. So we're seeing a lot of those cranial nerves that gave us a lot of trouble earlier on because we hadn't really seen their whole story. So the next thing I want to just talk about is how the other way to identify these different constrictors. So we have superior, middle, and inferior. If you don't have this really clean fiber orientation, you can certainly use cranial nerve 9 to help tell you the difference between superior constrictor and middle constrictor, because it enters right in between the two. Enters the pharynx, I should say. The other nerve to think about in terms of telling these apart is a branch of the vagus nerve, and you should look for this in sort of like the last couple of steps of the dissection. There's a couple of branches that come off of the vagus nerve medially. There's one that comes off quite high that goes up to the pharynx muscles called the pharyngeal branch of vagus. There's a couple of laryngeal branches as well, including one that actually goes into the larynx between the middle and inferior constrictors. And if I turn this around, you'll see that it's actually going through a little hole in the thyrohyoid membrane. And in that short space, you'll be able to see that internal laryngeal nerve passing between middle constrictor and inferior constrictor. There's also an external laryngeal, and these two come from a common trunk called superior laryngeal. So there's a little bit of work there to get those names straight. But that's going to account for the upper part of the larynx. The lower part of the larynx is supplied by a nerve called recurrent laryngeal nerve, which you've seen a long time ago. You probably remember this one from when we did the thorax, and we found the arch of the aorta. We had the vagus nerve, and we had the recurrent laryngeal nerve that went underneath the vagus, near ligamentum arteriosum. Sound familiar? Should. But anyway, here's our recurrent laryngeal. The rest of the story works its way up here alongside the trachea, between the trachea and the esophagus, and then it enters the larynx and pharynx just inferior to the inferior constrictor. So that gives you a sort of a sense for where the inferior constrictor ends and the esophagus begins. And I mean, it looks really pretty here, but it probably won't be so easily to visually distinguish these different boundaries. So the nerve trick really does help. So really focus on the relationships in this dissection today. I'm telling you, it's a pretty easy dissection to learn once it's clean, because everything typically lays just where it should. So have at it. I hope you enjoy.